And we couldn't figure out what happened. Was it love? Although I was in love with him for 1.5 years before we got married and I still had lupus. We didn't know. So I just kept doing what felt good for me. I just kept eating that way, take care of myself. And I didn't have any relapse. And so finally I did something, well, we did something that was against medical advice because I felt that I was healthy and I wanted to try. And we decided that we wanted to go ahead and get pregnant. Actually, my husband was terrified. He really wanted to adopt or surrogate. My mom wanted to be my surrogate. But I knew that I was healthy. My labs showed I was healthy. And, even when I got pregnant, they wanted me to go back on medications to keep me safe during the pregnancy. But I actually recently found lab tests that they did while I was previously before and while I was pregnant. And I'll show you, I have some of these. It might be hard to read, but this is 2004. So that was right before I changed my diet. And these are the blood clot antibodies that are high, as lupus antibodies that are high. And then this is me pregnant, all negative clotting antibodies, nothing. And then, I'm sorry, it's kind of hard to read, but this is the old days when it was not electronic, it's all paper. My ANA was positive here. And this was 2004. And then pregnant in 2008, negative. So according to all of my blood tests, I wasn't sick. And so I made the choice not to take the medicines and just to keep monitoring me. And so I went ahead and got through the pregnancy and I had a healthy baby boy. That's my Solomon, who's now 14. And this is what really changed what we did is right after I had my baby, this was me 9 days after giving birth. So when that happened, my husband went, I think I've cracked the code on metabolism here because I gained 40 pounds during the pregnancy and then just fell away. My birthday was 9 days after birth. So I got dressed up. And the other part that we had never really imagined or understood was that metabolism is not just about how easily you can lose weight or gain muscle, but it's about how quickly your cells can repair damage and function optimally, which also indicates that it can help you reverse disease. And that finally made sense as to why I no longer had lupus, even through pregnancy, which I was told I could never survive. That's when my husband and I started researching how can nutrition really be responsible for all of this. And as scientists, we didn't know about the plant-based movement. We didn't know that there was a such thing as plant-based doctors. We never even heard of the word plant-based. We just wanted to understand the science of cellular repair. And that's why I have a specific protocol for cellular repair. That is, it happens to be plant-based, but it's about using the nutrition your body uses for cellular repair and optimal immune function. And it's why it will help anyone, even if you don't have lupus. I did go one more time, 4 years later. That's me 2 days before giving birth to Alex, my younger kid. And we have such a fun family. Every year we get dressed up and do a photo shoot for Halloween. This was last year, Karate Kid. And that is Photoshop. My older son, Solomon, cannot jump that high. But we have a lot of fun. And there's my mom too. She lives with us now and she's the best. She goes along with it. But I want everyone to be able to have what I have, the ability to live life, to pursue my passions, to serve others, and to grow old with the person I love and raise my children. And with the information that I share, everybody can have that. And my husband and I decided to release our protocol to the public for free. And I'm going to show you how you can get 5 hours of this with all the details to the protocol for free at the end so that you can all have it and share it with everybody that you love. And this hasn't just worked for me. I'll give you some little examples of people. This is Julie, who had mixed connective tissue disease. Julie also had low thyroid. She was exhausted. She had kids that she just didn't even have the energy to take out and have fun with. And she did something called my 4-week rapid recovery program, where you have to work with me every single day for 4 weeks. And I optimize your nutrition, but also your lifestyle. I also happen to be an expert in trauma and anxiety. I thought maybe the path to me helping people the most would be to help them be happier with whatever life they had. Turns out that helps people heal. So I do everything it takes to help people get healthy and happy. And the happier you are, the faster you heal. So that's a big focus of my program too. Well, in 4 weeks' time, first of all, her thyroid went back to normal. And yes, this is helpful for things like Hashimoto's. And her doctor texted her, didn't you used to be hypothyroid? And yes, everybody who works with me gets my cell phone number. I want to make sure that everybody has the ability to get help whenever they need it or to share good news like this. After she finished the program, she said she finally had Dr. G energy, and she went from not working to starting 2 new businesses and going to Disneyland, and said her kids had to chase after her because she had so much energy. This is somebody who did my protocol from learning about it for free online. And she said goodbye to Graves' disease. And she had an antibody test to prove that she no longer had Graves' disease. This is someone who posted in our group Smoothie Shred. I saw some smoothie shredders in here. It's our free Facebook community for people who want to support each other on my plan. This is David, who was actually my first telemedicine patient that I helped, who had lupus, Sjogren's, and scleroderma. The picture on the left was the best medicine could do. This is him on tons of medicines, in pain, suffering. This is him after a couple of weeks on my protocol using nutrition. This is what his hands look like. I know it's a tough picture, but people with scleroderma, their skin gets so hard that just bending their fingers causes it to break open and their joints will get infected. There is no treatment for this in modern medicine to this day. They do not know how to help. In fact, his doctors told him before he started working with me that the only thing they could do was amputate his fingers. This is him after a couple of weeks on my protocol. He's someone who had been unable to work. He tried to work, but nobody would get past the interview. They couldn't look at him. And that's him going to work. He got a job at a nonprofit helping youth, underserved youth. He has had an incredible life from there. He has been off his medicine. Now, let me think how long this has been. This is from before my Alex was born, okay? So over 10 years now, he has been symptom-free and off his medication. And this is someone whose mother told them, his mother told me that the doctors said for her to start mourning that he would die soon. Well, he is doing fantastic. And those fingers they were going to amputate now create art that has won competitions in Los Angeles at art galleries. And they call him the rabbit at work and give him carrots for his birthday. And really, I mean, this is what I believe my purpose is. As a physician, it's about helping people live their dreams and live their lives. And this is his dream, and he's living it now. This is a nurse, Peggy. I have a lot of doctors and nurses and pharmaceutical representatives and pharmaceutical researchers who work with me. They know that I understand the science of cellular repair. They want it to be scientific, and they also don't want to take medicines. It turns out people in medicine are afraid of medicine just like you are. Well, she had terrible RA, and you can see, look how big her wrist was when she started my 6-week rapid recovery group. So that's a group program where I work with you every day on your happiness and your health and your nutrition to get you better as quickly as possible. So that's her when she started the 6-week program. Look how painful that wrist is. And that's her at the last meeting. That's the day before we hit 6 weeks, able to fully use her wrists again, where she couldn't do it for years. Oh, I love this lady. So 6 weeks, she was able to fully reverse her ANA at 70 years old. I have published reversing end-stage kidney failure, getting a person off the transplant list. I've also gotten someone recently off the lung transplant list. At week 5, his lungs were too healthy for transplant. This is someone who followed my protocol online for free. This is with no medications, only my nutrition, discoid lupus. This is lupus that attacks the skin. And that's her after less than 3 weeks. She said, nothing's ever worked before. Mariana was in my 6-week rapid recovery group. She had lupus in her brain, causing her to have multiple seizures every day. She stopped having seizures after a couple of weeks. Her lupus antibodies went from over 3,000 to 86 by the end of the group. She went from being home on her parents' couch to out living her dreams, traveling with her significant other. Molly Ann, oh my goodness, this was an email that somebody who did my rapid recovery group sent me. She had had lupus for many, many years, as well as other autoimmune diseases. And she said that she had eye inflammation for 9.5 years from dermatomyositis that was gone after 6 weeks in my group. Her liver enzymes, which had been high for 9.5 years, were normal. She then sent me another email that her internist, who'd been seeing her since she was 18 and she was in her 40s, was amazed and said that her other doctor emailed him to say, what is going on with this lady? Why is she so healthy? And on top of that, when Molly Ann was in my group, her son followed the diet with her and reversed his own lupus. His own lupus antibodies became negative, just following along with his mother. And so they wanted me to give a grand rounds. to the hospital to explain what the heck I did to help this woman recover. This is a retired teacher who was told that she was going to be in a wheelchair for the rest of her life. And in 6 weeks, she sent me a video of her walking up and down her hallways. Jackie, rheumatoid arthritis and mixed connective tissue disease. In 6 weeks, she had so many changes. She was showing off how she could hold a pencil. That was something she couldn't do. Her husband was in tears with how much better she was. And this is very short periods of time. I know a lot of times you hear from people that you change your diet, give it 6 months to see if it's working. No, it can be a lot faster. That for many people, it's a matter of days to weeks, especially in intensive programs where I'm looking over their shoulder. There she is playing and showing off on the trampoline in our Smoothie Shred group, saying that she was told that she no longer needed to take any medicines for lupus, stopped her steroids, and her blistering skin disease went away as well. All she wanted was to be a grandmother. It's even her Facebook name is about being a grandmother. And now she can have fun and jump around with her little girl. This is what health is about.